majority of no seems to be intent on saying no on health care too. And I'm wondering, if we don't get Republicans on board, are you willing to push ahead and with what the president wants and with what?
There are plenty of Republicans who get on board. You know, it's not a monolithic party over there, and there are plenty of stupid people who are Republicans. But guess what? They're all human beings, and y'all know disabled people, you know, sick people. You know, sometimes they don't know their politics. Sometimes they're raised in a family that might have, you know, been the other way. They can't help that. That's the way they're raised. And when you're sick, the last thing you want to worry about is politics. Yeah. What you want is a good doctor. You want a good hospital. You want it to work for everybody. And then once you're healthy, then you fool around with politics. But let's get well first. And see, I'm not saying you have to get a majority of the Republican Party. If you just get a handful, because they're out there, and they want to vote for something, but they don't want to be excluded from all the meetings, and they don't want to be talked down to, like we don't want to be talked down to. We wouldn't want a Republican plan rammed down our throats, but that's been the quote in the newspaper. Some of our most powerful committee chairmen, it's all in the newspaper. They use the word ram down throats of Republicans. That's just not nice talk. And I think the golden rule, being fair and square to people, not only does that help you pass the bill, it's not an option in the Senate, because with the 60 vote requirement, you've got to have it. This bill will not pass without at least 60 votes. And Tom Daschle, the Democrat that President Obama wanted to lead the debate effort, he said we should go for 70 or 80 votes. Because a good plan will get consensus. Sensible people will say, hey, this will work. This will work in Tennessee, it'll work in Ohio, it'll work in Indiana, it'll work in Iowa, wherever. So, and you need not only protection at the front end, you also need the protection on the back end, because when this is implemented, even the perfect plan will have some implementation hiccups. And that's when you need folks to be able to say, look, this wasn't a partisan deal. This was to help Americans first. And then I think you'll get a good result. You know, the president has said repeatedly, bipartisan, bipartisan, bipartisan. What part of that message is Congress not understanding? Because see, we have so many fights here, and everybody wears a team jersey, and they love beating each other up. After a while, there's scar tissue, and you start hating the other side. But the way I believe is, you're really not supposed to hate anybody.
That's right.
Like maybe the devil or somebody, but not because we're all sinners. We're all human beings. We all have strengths. We all have weaknesses. Let's learn to live as neighbors and help each other. Then we'll have a stronger country. And my guess is that's what Barack believes. And let's help him do that. But if you let Congress do it, we'll have a partisan mud battle, and we'll call each other names. And, you know, it's not, especially on health care, because this has got to work for everybody. So that's basically all I said in the press conference. And, you know, it's like, I get beat up for that. It's like, you know, but it's one reason we've been unable to make progress in this debate, because everybody wants to make it, I win, you lose. A good health care bill would be win, win, win. Win for everybody. And we have a huge opportunity in Nashville, because now we can live up to our title as healthcare capital.
Well, I would disagree with the statement of healthcare capital, just on its premise, because the majority of the hospitals there, and I've worked for a couple of them, are completely profit-driven, and I have seen shortcuts and understaffing and putting people out that had no aftercare that we knew for a fact could not take care of themselves, to the point of preserving that dollar, that I don't believe their motives are true in any way. Meaning, I'm not one on the side that can be convinced that they have anything other than a motivation to keep making it.
Yeah, but you might not like the fact that we're in Music City too, but hey, we're in Music City.
I don't have a problem with the term. We live up to that.
Music business, you know.
We live up to the term Music City. I think that we have a long way to go to being considered the healthcare capital.
It's more practice what you preach.
Correct.
Yeah.
Right?
But I will say